I'm Latisha Hooper, and I'll be telling you about the nursing program, of course. Um, my general subject about this is the nursing program. My general purpose is to persuade. My specific purpose is to persuade audience that nursing plays a big part in people's lives today. My attention getter is nurses are life. Everyone should know without nurses today, there will be a lot of lives gone. I have spent a lot of time researching on this subject. Today I will explain the advantages of being a nurse and the actions we perform that goes unrecognized. A nurse is one of the highest paying jobs, of course. Being a registered nurse you can make at least $55 to $70 an hour, and being a licensed practitioner nurse is a LPN, which you also get paid well. You can make at least $30 an hour doing that. There are about 2,700,000 nurses who are employed in the U.S. in 2010, and now in 2013 there are about 5 million. About half of them work in hospitals. Some had jobs in doctor's office and nurses' care facilities, or were employed by home health care services. Some nurses work at schools. Some work at correctional facilities. Some work at nursing homes. Some do home health. So it's a lot that nurses can do. A registered nurse, which is RN, treats patients and provide advice and emotional support to them and to their families, because some people who's like in a nursing home or whatever, they need a friend. They need someone who will tell them what's going on, tell them it'll be all right when family isn't there. Some RNs educate patients as well as the public about medical conditions. So if, for example, if I had a friend and her grandmother was sick, I would probably be the one to go and tell her that grandmother isn't doing well. They send registered nurses to do that. To work as a registered nurse, one must earn a Bachelor's of Science degree in nursing, which is the BSN, associate degree in nursing, which is the ADN, or diploma in nursing. BSN programs are often offered by colleges and universities that generally take 4 years to complete. ADN program offered by community and junior colleges take 2 to 3 years to complete. Diploma programs usually 3 years long by hospitals. Registered nurses, like other professionals who deliver patient care, must be compassionate. You have to love your job. To be a nurse, you have to love your job. I'm not a nurse yet, but that's why I'm going to school, because I love helping people who can't help themselves. You have to be compassionate. You have to love your job. Get up every morning, night, or whatever shift you're on. Go to your job and be ready to help. Be ready to encourage. Be ready to make things better. To be a registered nurse, you need good organization skills. And being detail-oriented helps ensure that all procedures are properly followed, which keeps patients and workers safe. Also, being a nurse, you see all the patient, you see all the information. So, you have to sign a paper saying that you will not, like a privacy policy. Because you can't tell everyone about that patient. You can't tell everyone what the patient going through, what's the patient name, date of birth, all their social security number. You cannot tell that, because that is hospital policy rules. Nurses are depended upon more than you think. They are helpers, guiders, and friends. As a nurse, it's a lot of things that goes on that you really don't think goes on. There's a lot of things that nurses go through. Of course, a nurse is up under a doctor. RN is above LPN, which is an LPN is above somebody who just work at the nursing home, of course. But me, I'm going to school for RN, and I'm very compassionate. I like helping others, as I said before. I'm very helpful. I'm always there to listen when people have problems or when something not going right. That's about it. Thank you.